Perna. We're so happy to have you here today. Today's going to be Jack's first day in our therapeutic nursery.
I'm happy to be here, but why am I here?
Well, I'm just here to show you what we have going on and to show you what a typical day for him will look like. So, as you can see right through here, each classroom has its own observation room. So if you ever feel that you want to come and watch what he's doing, you're more than welcome to come and watch. The observation rooms are used for staff, students, and anyone who would just like to come watch one of our therapeutic nurseries. We have 5 classrooms. Each classroom has about 15, 16 students in it. We also have an outside playground where they can play and before and after lunch. We do a lot of therapeutic activities with them through the day. Did the psychologist explain to you what he was diagnosed with?
No.
Okay. So, before we leave today, I will get you a couple pamphlets defining what he is definitely diagnosed with, but he was diagnosed with ADHD, which stands for Attention Deficit Hyperactivity Disorder. This basically means he has a lot of trouble paying attention and staying still. Would you agree with that?
Sometimes, but I mean, isn't that typical for a 3-year-old boy?
Well, this is because of what he has witnessed and what he has gone through. And you know as well as I do what he expressed to us. But would you agree that sometimes you can be saying something to him and he just doesn't even listen? Or you feel like he's somewhere else?
Yeah.
Okay. So the other thing that Jack was diagnosed with is ODD, which is Operational Defiance Disorder. This means that he has trouble just listening to authority figures, and whenever someone new comes in his life who is expected to be authority figure, he doesn't pay attention to them and just thinks he can do whatever he wants.
So this, bunch of letters, I don't know, you just gave me the alphabet pretty much of what my son has. Is this something he's going to have for the rest of his life, or is this something he's going to grow out of?
Well, this is something that we can help you with at the therapeutic nursery. Along with being in the nursery with a whole bunch of other children, he will also have pull-out sessions with one of our clinicians. His clinician is named Miss Katie. She will pull him out from time to time to do one-on-one sessions with him to track his progress. The other behavioral workers will also track his progress daily. So you'll have access to daily notes about him, what went well, what hasn't went well, and just basically what's going on with him and how we can help him here. Typically when children are brought in at the age of 3, which like your son is, he will be dismissed when he's around 5, 5.5, because in time for kindergarten. That could be the summer before he starts, or it could be the week before he starts. Also, he could be discharged to go to a regular preschool in a year. We've seen some children be in and out of here within 6 months at some times. It's all in how well they respond to treatment and how open the parents are to willing to help continue the process at home.
So I have a couple questions. Am I allowed to speak with Miss Katie when I feel the need to?
Yes, Miss Katie will call you on the days that she has one-on-one sessions with him.
And typically you said about these observation rooms that students and other people can go in them. Do many parents go in them, or is it something that's generally parents don't do?
Generally parents don't. They'll go to a lot of the children are brought in on vans in the morning and picked up in vans in the afternoon. But if parents do want to come and observe, they have to go through the 6th floor first to get a pass and then have someone bring them down. But parents are more than welcome if they really feel the need to come observe. But the thing about students is they come and observe because our therapeutic nursery is one of the really unique things about the Children's Crisis Treatment Center. So they can come watch how the children interact with each other, how the children interact with the clinician, which is Miss Katie, how the children interact with their behavioral workers. There's 2 in each room, so at all times there's always 3 or more adults in each room. So the point of the observation room can even be sometimes if Katie isn't even in the room, she can watch how the children interact. and just see how.
And if he should do something, she would let me know.
Yes.
And how many days a weekend does she meet with him?
Typically, since he's just starting out, it'll probably be about once a week. Could be once every other week. It's all defined on how well she feels that how much she needs to see him. Also, we have, this wouldn't be the case in his case, but we also have a speech therapist who comes in to see some of the other children.
Oh yeah, Jack doesn't need that.
Yeah, he doesn't, that's not on his chart, so he doesn't need that. But, is there anything else you have any questions about just generally CCTC, or how much you can even become involved? Would you like to know other ways that you can become involved?
Yes, please.
Okay. So, we have an association called the Caring Friends of CCTC, where it's a group of parents. We meet monthly. Once a month we meet with the parent caregiver coordinator, and the other times it's just with you guys. You come up with some events that you guys can have for the families, and you also talk about sanctuary, and you also talk about just what's going on with your children and suggestions that you want to make to the center.
And can you further explain about sanctuary?
Oh, I'm sorry. So what sanctuary model is, it's a way of having clinicians to be focused on well known about trauma. So the way that the therapeutic nursery has their sanctuary every day, generally with the adults, they have a meeting every morning with 3 questions. How are you feeling today? Which has to be with a strong feeling word. What is your goal for today? And then who can help you with your goal? So with the therapeutic nursery, we change it around a little bit and ask them, we ask them still how are they feeling today, and we encourage them to use strong feeling words like excited, nervous. We get hungry a lot because we do it right before breakfast. So then we ask the children what a classroom rule that we have. So a lot of them say don't throw things, don't scratch anybody else, only take toys off the shelves when they say you can. So basically that can vary day to day. And then the last question is who can help them. And sometimes the children will say everyone, sometimes the children will say the teachers, sometimes they'll say their friends. It all really depends.
Going back to the classroom setting, is it mixed, both girls and boys?
Yes, we have. Okay, so in your son's classroom, it's even 8 girls and 7 boys right now. Since we like to cap them at 15, sometimes 16, but his classroom will stay at 15. We like to think that there's a nice mix of all personalities in the room too. I noticed that Jack likes to play with trains. He's playing with them right now. Mm-hmm. So we have a lot of Thomas the Trains, and we have train tracks, and
Thomas is his favorite.
Okay, we'll have to make sure to tell his clinician that. So, do you feel that if the clinician would have a one-on-one session with Jack and would able to have him play with toys, would you suggest trains?
Yes, trains always work when we're, trying to get Jack to do simple tasks, and, trains are always the best incentive for him.
Okay. Well, something we encourage our parents to do is to try to take the notion of the community meeting home. So what that can look like for you is, when do you think that you spend more time with Jack, in the morning or at night when you tuck him into bed?
At night.
Okay. So what you can ask him is how he's feeling and if he would like anything else. And just ask him something simple as, what did you do today? Did you have fun today? And who did you have fun with? Do you think that's something that you could possibly incorporate into your nightly routine?
I'll try my best because I want to get Jack out of here as quick as possible. And I'm not saying this isn't really, a normal thing, but I just want him to be able to grow up and, go to preschool when he's supposed to.
I mean, even if you just ask him what he did for the day and who he played with, I feel like that wouldn't be normally out of a typical routine for nighttime. Now, do you ever read to Jack?
If I'm not too tired, every now and then I'll try and, pick up a book to read to him.
Okay, well, we encourage our parents to read it sounds like you're really busy, so maybe even if you just make a goal to have it once a week, Or does that sound like it's...
That's pretty doable.
Okay. Well, we have a variety of books in our library. We have a lot of Dr. Seuss books. Since Jack is 3, we do have a section of just picture books, so we encourage them to look through the books as much as they can. Do you have any other questions?
Not right now. No.
Okay, well, it was nice meeting you, and I will talk to you next week.
Thank you.